So today we are announcing 31 new cases of COVID-19, bringing the total number of confirmed cases in Nova Scotia to 373. There are currently 10 individuals in hospital. 4 of those are in intensive care. 82 people, good news, 82 people have now been recovered and considered that their COVID-19 infection is resolved. We've tested 12,346 Nova Scotians that number have been negative. So to me, that's an indication we are testing a lot of people. The vast majority are negative, and that's really good news. As the Premier said, sadly, I have to confirm that Nova Scotia, we are reporting our second death due to COVID-19. The deceased is a woman in her 90s with underlying health conditions who passed away in hospital in Cape Breton. I also want to pass my sincere sympathies and condolences along to the family. The loss of a loved one is difficult at any time, but losing a family member at a time when we are being asked to stay separated must be especially challenging, so my deep sympathies. I cannot stress enough the importance of following the public health measures we have put in place. We're all at risk from this disease. Some more vulnerable than others, but the impact of the virus and the impact of what we are putting in place to control the virus is and will touch all of us. So if you're not worried about yourself, please think about those in your community, those who are most important to you, and what you can do to help them and protect them. We are heading into a long weekend, but it's going to be a very different long weekend than we are used to. People on the front lines of this pandemic in our healthcare system and in our grocery stores and other places are not going to take a break. The virus is not going to take a break either. So please remain vigilant, follow the public health measures, stay at home as much as possible, and monitor your health. If you are experiencing symptoms that could be COVID-19, and those are the things we're looking at, people with 2 or more of fever, new or worsening cough, headache, sore throat, or runny nose. If you think you have those symptoms, please go, if possible, go to the 811 website and do an assessment there, and they'll direct you further about whether you need to then call 811 and go for testing. If you don't have internet access, then you can go directly and call 811. Don't wait till Monday or Tuesday thinking that the healthcare system may not be there for you. We have 811 is a 24/7 service. Our assessment centers are operating throughout the weekend. The healthcare system will be there for you if necessary, whether it's COVID or some other health concern. But if you think you might have COVID, don't wait until Tuesday or Wednesday, till the Easter weekend is over. Do the assessment as soon as you can. I'd like to clarify some of the processes that we have in place now for workers coming into Nova Scotia. My public health order states that only healthy workers in certain professions and industries are exempt from self-isolation when they cross our borders. This is necessary to keep goods and services moving throughout our province and to allow people who cross our land border just north of Amherst on an ongoing regular basis to go to work, that we need to allow those people to move. Today, we are announcing that we have made a change that does impact fishers and offshore workers and temporary foreign workers. Any offshore worker or fisher entering our province must self-isolate for 14 days. Fishers can self-isolate on their vessel, provided they're able to do so for 14 consecutive days. We recognize that they may need to dock to get supplies, but they can do that without leaving their vessel and have the supplies delivered to them, and then go fish for that 14-day period. There's also been questions about temporary foreign workers. We know that there are several industries in our province, important industries, that rely on these temporary foreign workers. A key one is our agricultural sector. Temporary foreign workers will be allowed to enter the province, but they too must self-isolate for 14 days when they arrive. That is a requirement under the Federal Quarantine Act, and is also now a requirement under my provincial public health order. The provincial government is working with the agriculture sector and other industries as necessary to develop the appropriate capacities to ensure adherence to this 14-day self-quarantine period. I know that this virus is causing people to feel afraid. I understand that. For almost all of us, we've never been through anything like this before. It's natural to be afraid. That's okay. We need to talk about that fear and say and allow that fear to be out in the open and be validated. We also have to remember that there are things we can do that give us some control over this, the things that we can do to protect ourselves and protect each other. And that by focusing on recognizing that fear is okay, but by focusing on what we can do to help each other and protect ourselves and each other, that gives us some sense of control. And by doing that, we know that we can get through this and we'll get through this together. I continue to hear some stories about unfortunate the way people are being viewed and perhaps treated in our communities. We have truckers that are being denied service, healthcare workers who are being shunned or treated differently because people are afraid that they may carry this virus. We have still some targeting of people from specific groups within our community, somehow under the belief that they are the cause of this virus, or they're much more likely to be spreading this virus in our community. It's important that we understand that this virus affects all of us, that we all are at risk. But the way we deal with that is by being kind to each other, by supporting each other. So I really plead to people that let's not be judgmental of each other. As I've said before, this is an opportunity for us to look at each other with caring and compassion. We're about to enter our Easter weekend. We are in the middle of Passover, and soon it will be Ramadan. These are important religious celebrations to many in our community. And like so many other things right now, these religious ceremonies will need to be very different. No in-person services, gatherings, or meals. But they do remain an opportunity for strong emotional connection and building community virtually. In my faith, Easter is a time of hope in the darkest of events. The same is true of Passover. Ramadan has a strong focus on reflection and service to community. I would encourage all Nova Scotians, regardless of their faith or point of spiritual connection, to see that as challenging as the pandemic is for you, your family, and your community, there is hope and we will recover. If we focus on caring, kindness, selflessness, and building up community, we will get through this, and maybe we will be better. We'll be different, but maybe we can be better. I care deeply for this province, and I care for each of you. I hope everybody has a safe weekend staying at home.